We've all been told repeatedly that exercise is essential for good health. How can we make it a part of our daily routine? This is the People's Pharmacy with Terry and Joe Graydon.
Research shows that cancer patients live longer and better if they follow an exercise prescription. But how do we get cancer doctors and insurance companies to make exercise a priority?
Cardiologists routinely prescribe cardiac rehab for heart patients. Insurance companies cover it. Why shouldn't cancer patients get affordable cancer rehab?
What lessons from the new research can all of us apply to make our daily lives healthier?
Coming up on the People's Pharmacy, the healing power of exercise prescriptions.
In the People's Pharmacy Health Headlines, COVID-19 has an impact on blood vessels that's especially pronounced in women. French researchers recruited 2,390 patients between 2020 and 2022. Some of these individuals had not had COVID, while others had experienced infections of varying severity. To measure the impact on blood vessels, the investigators utilized a technique called pulse wave velocity. It measures arterial stiffness by tracking how quickly pulses of blood pressure move through the blood vessels. Usually the comparison is made between the arrival of the wave at the carotid and femoral arteries. Higher pulse wave velocity indicates stiffer arteries. The researchers found that women who'd had COVID had stiffer arteries, especially if they had been hospitalized with the illness. 6 months later, women who continued to have high pulse wave velocity were more likely to have symptoms of long COVID, such as brain fog. An accompanying editorial points out that arteries typically stiffen with age, so COVID has increased vascular aging.
The American Heart Association and the American College of Cardiology have updated their guidelines for defining and treating high blood pressure. The last time these guidelines were revised was 2017. The definition of normal hasn't changed. It's still blood pressure under 120/80. If someone has regular readings above 130/80, treatment is advised. Lifestyle changes are the first step, including avoiding alcohol, reducing salt, and increasing potassium intake, managing stress, exercising 150 minutes a week, and losing weight. If such lifestyle modifications don't work after 3 to 6 months, though, the new guidelines recommend medications. The guidelines minimize the chance that aggressive blood pressure treatment to get everyone below 120/80 may result in adverse effects, including dizziness and falls. A recent viewpoint in JAMA Health Forum warns that older people on multiple medications are at risk for life-threatening falls.
Past studies have shown that people with hearing loss are at higher risk for dementia. Now scientists have found that using hearing aids can help offset that risk. They conducted audiometry on nearly 3,000 healthy participants in the Framingham Heart Study and followed them for up to 2 decades. 20% of these folks had developed dementia during that time. About 2/5 of them had been younger than 70 years old at the time of their hearing assessment. People who used hearing aids for their under 70 onset hearing loss were 61% less likely to develop dementia. In comparison, people with no hearing loss at all were 29% less vulnerable to dementia. The researchers emphasize the importance of early intervention for hearing loss.
Exercise physiologists are frequently asked which equipment is best for rehabilitating a particular health problem. This is especially important when it comes to people with breathing problems. A new study published in JAMA Network Open asked the question whether minimal exercise equipment could be as helpful as specialized exercise equipment when it comes to pulmonary rehabilitation. This 8-week randomized clinical trial involved 2 supervised personal sessions a week for 2 months, with follow-up a year later. The minimal equipment exercise program involved walking, body weight exercises, and resistance bands. The specialist equipment involved the use of treadmills, ergometers, resistance equipment, and free weights. Personal trainers supervised both groups. The investigators measured exercise capacity, breathlessness, and health-related quality of life. Both exercise programs were effective in improving the 436 participants' overall health. The authors concluded that minimal equipment was just as effective as high-tech gym equipment. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. We're frequently asked, what's the one most important thing we can do for good health? There's no simple answer, but one of the strongest candidates is exercise.
Last week, we spoke with a medical oncologist about his groundbreaking research showing that a personalized exercise program can improve survival from colorectal cancer. This week, we're taking a second look at a similar topic, but from the perspective of an exercise physiologist.
Our guest is Dr. Claudio Battaglini. He is professor of exercise physiology and director of the Graduate Exercise Physiology Program at the University of North Carolina at Chapel Hill. Dr. Battaglini is co-director of the Exercise Oncology Laboratory in the Department of Exercise and Sports Science. He's also a member of the UNC Lineberger Comprehensive Cancer Center.
Welcome back to the People's Pharmacy, Dr. Claudio Battaglini.
Well, thank you very much. I'm very happy to be here.
Dr. Battaglini, it is so nice to have you back on the People's Pharmacy. And there's so much that's happened since we talked to you the last time about exercise and cancer. Just last week, we were talking with Dr. Christopher Booth about his absolutely extraordinary research in the New England Journal of Medicine about colorectal cancer and exercise. You were part of that study. Your group was involved. Tell us what they found.
Oh, this is a huge discovery for the world of exercise oncology, without a doubt. Dr. Booth, Dr. Carrie Cornea, and the whole team of researchers that have been looking into, validating, how important exercise is for the past 10, 12 years. That trial, that's how long it took for them to really understand the real effect of exercise in colorectal cancer on the CO21 trial. We were a very small part, a site at UNC. Dr. Steve Bernard, who is already retired, and I were the responsible folks, for the site here at UNC. But that study is absolutely terrific. When it came out at ASCO this year, when they presented, and the findings that exercise compared to a chemotherapy group really show incredible results. I mean, that's what we needed as another boost in our area for people to understand the value and the importance of, individualized prescriptive exercise for cancer patients. So amazing, absolutely amazing work.
Now, Dr. Battaglini, when we talked to Dr. Booth last week, we told everyone he's a medical oncologist. He's a medical doctor. Your doctorate is in exercise physiology. Tell us a little bit more about that, please.
Yes, that's correct. So many years ago, my dream within exercise and sports was to be a coach, one of the best coaches in the world, a scientist of the sport. But things changed drastically when I was, exposed to cancer through my advisor in Colorado. And she had cancer, and just to make the story a little short, she was very interested in start exploring the benefits of exercise in cancer patients. And I'm talking about almost 25, 30 years ago. And she was very progressive, very intelligent. And we did. We start looking at, okay, what is the benefits of exercise? At first, I didn't want anything to do with that. I want to coach the fastest and the strongest athletes in the world. But when I got involved and I was one of the student founders of the Rocky Mountain Cancer Rehabilitation Institute, I started understanding the value of using my expertise in exercise training, to help cancer patients to improve their long-term, prognosis potential. I didn't know that at that time, but what I did know is that putting them through this exercise regimen, they're all feeling better.
They
They're
felt
doing better. Their fatigue levels are down. And that was fascinating to me to see the importance of that. And then my career shift from coaching super high-level athletes to dedicate a career, examining the effects of exercise in mitigating side effects and also hopefully promoting, better long-term prognosis.
So you mentioned that you helped set up the Rocky Mountain Cancer Rehabilitation Institute a long time ago. Does it still exist?
Yes. I was one of the students involved in that process. And that effort was led by Dr. Carol Schneider, which unfortunately passed away with cancer many years ago, and Dr. Carol Dennehy, and also a physician, Dr. Susan. I forgot her last name at the moment, but these three individuals work relentlessly to build this capacity to provide the patients in the northern Colorado area with the ability to come to the facility, benefit from the effects of exercise.
Now, Dr. Battaglini, you have had exercise as a part of your life from early days. I mean, for one thing, you were a star football player, soccer in the United States, in Brazil. So tell us about your passion for exercise, initially on the football field, but you've also carried it through to swimming to this day.
Yes. So it was interesting because I grew up in a family of athletes, basically, right? My father was an athlete. My mom ended up playing volleyball growing up. And very early on, one way for our parents to keep three boys out of trouble is to keep us really busy. And they put us in all kinds of sports. So we were very fortunate to be able to experience soccer, tennis, judo, swimming, and all those sports growing up. So sport really was engraved on all three boys' lives. All of us, we do different things today, but one of my brothers is a lawyer. The other one is a professor in Carleton College in psychology. I'm here at UNC. But sport has been a massive part of our lives. And growing up and excelling in some sports, I learned very quickly that, okay, sports is a big part of my life. Exercise is a big portion of my life. And one day in high school, a PE teacher organized a program, and I was one of the students in the program. When he finished the program, he came to me and said, you know what? You can be an amazing coach. And that was the little motivation that I needed to pursue exercise science. Although both of my parents were lawyers, and they're not too thrilled that I was going in exercise science, they wanted me to be a lawyer. I said, no, I'm going to follow my own path.
And now you coach swimming, and you have become renowned around the world for your swimming techniques and skills as a coach. But the idea of being a coach for cancer patients, that is what really ignites your intellectual excitement, your curiosity. That segue into the cancer world was partly because of your advisor. But it wasn't just a momentary interest. It's become your career.
Right. You see how life is sometimes, right? So when I met Carol Schneider, and she brought me in to be part of her program and as a grad student, and I told her, look, I want to be an exercise physiologist. I work with professional athletes. I am currently work with a lot of professional athletes. Am I able to bring them to the lab, test different exercise regimens, look at why certain individuals are adapting to certain different types of exercise? That was my goal at first. But when Schneider involved me on the Rocky Mountain Cancer Rehabilitation Institute, and she asked me to exercise a cancer patient, then everything changes. I started with a high-grade glioma patient that the physicians gave her only 6 months of life.
Glioma Brain cancer.
Correct. Very
And
aggressive.
a bad kind of cancer.
Very aggressive. And she was given only 6 months of life. And Carol Schneider called me and said, I would like for you to work with her. And I said, nope. Schneider, I don't know anything about cancer. I don't want to be involved in this. I came here. You promised me. Let me work on my athletes and exercise physiology. And knowing that she was going through a very hard time and she has given me an opportunity of a lifetime, I couldn't say no. So I said, okay, I will come and meet the patient in the morning. So that changed everything because that girl that we work with ended up living over 2 years.
And how old was she when she was diagnosed?
She was my age at that time, about 23 years old.
Oh, my.
So that's pretty early for glioma.
Very early.
And the prognosis was horrible. I mean,
really bad.
6 months to a year would be absolutely the most you could expect.
Terrifying.
So tell us what you did.
So when I met her, I asked her, and it was the wrong question. I said, okay, how are you doing? And she says, okay, what did the doctors tell you? Wrong question. She said that I'm going to die in 6 months. And I think it was my coaching instincts, and I turned around. It was a bad question. And I said, but what do you think about it? She said, I'm going to prove everybody that I'm not going to. Can we get started? And I'm like, wow, if my athletes have this type of a heart, oh my goodness, we'll have champions all, So, but that's how it started. And I started working out with her, and I didn't know anything. I didn't know what I'm doing. I'm coaching her like I'm coaching athletes. I want to get her stronger. I want to get some muscle on that body. And one day Schneider came by, looked at me, and said, what are you doing? I said, I'm getting her stronger. Look, she's looking better. Her oxygen uptake is increasing. Everything's going well. I said, no. You're missing the picture here. All right? You are trying to just keep her health. You're not training her for the Olympics. and that hit me hard, right? And unfortunately, there's a whole story behind that, but she passed away 2 years later after being in the program for quite a while. The doctors were amazed that she
survived
that longer. Oh my goodness. It was incredible, right? But when she passed, it was very hard for me.
Sure.
I was like, I don't want to ever do that again. So, and then Schneider, I have another patient for you. Breast cancer patient. And I was like, nope, now you are. And then he comes, another faculty, said, did you know the difference you made in the life of this person? We need to do this.
You're listening to Dr. Claudio Battaglini. He's professor of exercise physiology and director of the Graduate Exercise Physiology program at UNC. Dr. Battaglini is co-director of the Exercise Oncology Laboratory in the Department of Exercise and Sport Science at the University of North Carolina at Chapel Hill.
It's time for a short break. In just a minute, we'll hear how a breast cancer patient fared with exercise.
New research suggests breast cancer cells change their behavior when the patients do resistance training.
How can you pick the right kind of exercise for each patient?
You're listening to The People's Pharmacy with Joe and Terry Graydon. This podcast is brought to you in part by Sonu.
Ready to breathe like never before? Meet Sonu, S-O-N-U, the world's first FDA-approved wearable headband that gives you drug-free relief from nasal congestion in minutes. It's safe for adults and kids 12 and up, making it perfect for families dealing with allergies, sinus issues, or chronic stuffiness.
Sonu uses personalized sound-based therapy to naturally open nasal passages. No meds, no steroids, no sprays. Even better, up to 4 users can share one account so the whole household can benefit. Compatible with both Apple and Android smartphones.
Learn more at getsonu.com. That's G-E-T, get, S-O-N-U, sonu.com.
Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is brought to you in part by Sonu, an FDA-approved drug-free treatment for nasal congestion and runny nose, using sound instead of steroids. More at getsonu.com. That's GETSONU.com.
Today, we're exploring how exercise can help everyone live better. We're especially impressed with new data demonstrating that structured physical activity can improve longevity for cancer patients. How can you pick the right exercise for you?
We are talking with Dr. Claudio Battellini. He is professor of exercise physiology at the University of North Carolina at Chapel Hill, and he's director of the Graduate Exercise Physiology program there. Dr. Battellini is co-director of the Exercise Oncology Laboratory in the Department of Exercise and Sports Science at UNC. He's also a member of the UNC Lineberger Comprehensive Cancer Center.
Dr. Battellini, you were just telling us about a breast cancer patient that you worked with back when you were a graduate student, still working at the Rocky Mountain Cancer Rehabilitation Institute. Can you tell us about that patient?
And you were a little reluctant.
Absolutely. Absolutely. So she was my first patient, my first breast cancer patient. It was a tough diagnosis. She had a triple negative diagnosis, which, you don't have as many treatments available to try to beat the disease. And she came in very scared. She didn't know what to expect. She looked very frail, very tired, very fatigued. And I started working out with her and training her. She started opening up. She started feeling better. She started feeling more confident. And it's funny because one day, after a while, her husband came to the facility. And he said, I would like to know who is Claudio Battellini, because my wife cannot stop talking about this guy all the time.
What's going on here?
And I met with him. Dan was a terrific guy. And to make this story short, not only she did extremely well, she's still alive this day.
She's still alive?
She's still alive. Every 5 years, she tries to come back here to North Carolina from Colorado to thank me. And I said, I'm the one that have to thank you. And there is a little pink dumbbell on my desk in my office. She brought for me as a present. Says, "Your number one patient." And that changed everything, because looking her, and she has a beautiful family, children. She needs to be around, and for the exercise to have helped her so much. Really, it was something that, to me, it was the game changer. I said, wow, I can use my expertise as a coach, all the training methods that I use, although I didn't know anything about cancer. Still, we still have a lot to go, but we learn a lot more now. I said, okay, it's time for me to take this on and change my career and become an exercise oncology researcher. So that definitely, it changed my life forever.
Let's talk a little bit about breast cancer, because you have actually focused on that in much of your research. You have dealt with many women with breast cancer, and it's not just the physical benefits. There are psychological, emotional benefits of exercising together in a group. Tell us about that.
Yes, you're absolutely right. I think for women with breast cancer, particularly at the beginning, when we started the Get Real Heal program at UNC 19 years ago, we were doing individualized training. Mm-hmm. So the women come in, we have a student trained by me and Dr. Groff, Diane Groff, my co-investigator. She was terrific. She did a lot of the psychometrics, and so the emotional training, the mental training with them. She was fantastic. We work with these patients. It was hard, right? Because one-on-one, they didn't interact with each other, with other patients.
Right.
They loved the program. The exit interview that we did with them showed clearly, we love this program. It's a lifesaver, but we never interact with the other patients. And a lot of the women, they need that social network. They need to talk about things that they're not going to talk to me as a male, the issues that they're having with a family, with husband, and intimacy. They're not comfortable sharing that with us, right? And then Dr. Groff and I start understanding, and not only that, for the cost too, right? Only one patient per trainer, it would cost significantly if you want to translate that into the real world. But when we discussed and said, okay, we need to do group workouts. We need to have these ladies to come together in groups of 5, 6, 8. It's going to be more challenging for the trainers because we want to be very careful with what we're doing. But the first day we inaugurated the group workout to give them that ability to have an emotional, social network, emotional support, right? They left the facility, all smiling, happy, and they were in the parking lot. And then I look at, and they were there talking, 5, 6 ladies. And then an hour later, go back, and they're still there in the parking lot. And then I realized we did the right thing. We did the right thing.
A lot to talk about.
Correct. And so, to your point, yes, the emotional support, the social network during the treatment, during this, even after treatment, you're learning your new abilities, how your physiology is behaving. It's critical. For women with breast cancer, even more. I learned that throughout the years. And that's a very important piece that should never be understated.
Well, we've recently seen research showing that resistance training actually changes the way that breast cancer cells behave. So it's not only emotional support. It's going actually into the physiology of the cell itself.
No, absolutely. A combination of all of those factors. That's why we like to think about, when you talk about cancer rehabilitation, look at this very comprehensive approach, an approach that we incorporate the guidelines, right, that states that a combination of aerobic exercise plus resistance training seems to be the best, prescription at the moment. But we cannot also ignore, the other factors that are part of human life. The emotional support, the social aspect, the mental aspect. Some of these patients are still very anxious. Some of them are depressed. Some of them are still fearing the disease because sometimes the uncertainty, it's a really burden. So to your point, yeah, not only resistance training has been shown more and more a very powerful intervention, right? But the combination from guidelines that has been written at American College of Sports Medicine, in American Cancer Society incorporates both. But this emotional support, this extra psychological processes that the patients are undergoing, in my opinion, they should be addressed as well.
I am thinking that one of the objections that we occasionally hear from physicians who say, well, of course, I know that my patients should exercise. I tell them to exercise. They're not motivated. They don't get up and do it. And what you're suggesting is that having a group that means something to you could provide some of that additional motivation. What else does your program do to help motivate people to really show up and move?
Right. No, without a doubt. I think you make a very important point. And not only in cancer, in other diseases as well. For example, we just finished a study on people with schizophrenia with Dr. Dave Penn, another fantastic research from UNC and his team. And schizophrenics, for example, are folks that really are very lonely. They live 20 years in average less than a normal person. And so they don't interact. And we did a study using walking in groups. We bring them to the clinics. When they come to the clinics, get a group of folks and take them for walks and create a training regimen for them. Oh, my goodness. We found some amazing things about that. Now, going back into the cancer world, how can you motivate the patients to get back to the gym? That's a good point, because a lot of times they're doing research with people that are very biased, right? They want to get better. They want to do it. They're previous exercisers. So my recommendation is, well, one, first and foremost, the creation of those community-based programs are important because we can make that available to them. A lot of times they don't have the motivation, but they also don't have where to go.
Right.
To get the expertise to engage in regular exercise safely because they have concerns about their health. So I think having those community-based programs like the one we have in Chapel Hill, the Get Real and Heal program, the patients can come in and exercise and have instructions instruction from folks that have done this for a long time. I think that's one of the pieces of the puzzle. Have those facilities to be available, because a cancer patient not going to go to a regular gym and start exercising in the middle of everybody. I mean, forget about it.
Well, I can imagine that if you were a cancer patient, perhaps a little immune suppressed, you don't want to go into a gym where
Absolutely.
everybody is breathing out their germs all over the place.
Oh, that's a great point, and that's a great point.
Well, the other thing is that Dr. Christopher Booth's research with colorectal cancer, there were two factors that I think are really critical. Number one, personal trainer. So if you have somebody who's waiting for you and
yes.
it's on the calendar,
Yes.
you are much less likely to say, oh, it's rainy today. Oh, it's too cold today. Oh, it's too hot today. It's like somebody's waiting for me. My trainer or my group is waiting for me. They're counting on me to show up. More than likely, you're going to come.
Yes.
And then the other piece is, at least with now the data that is accumulating both for colorectal and breast and other kinds of cancers, you could live longer. You could live better. So there's an outcome that will have a direct impact on your life.
You might be able to live long enough to see your grandchild graduate from high school.
That's the
Something
goal.
very specific.
Right. No, that's the goal, the motivation there, right? To find the motivation. But as you said, when they come and start coming to the program, they start feeling better fairly quickly. And that is why, if you look at the adherence rates for those types of programs, they're incredibly high. They come. The patients in a group format, as I mentioned before, there is the sense of accountability. If you don't show up, your own group members will be calling, hey, what happened?
Are you okay?
Are you okay? Why didn't you come today? Oh, I had to take my grandkids. Oh, okay. We're just checking on you. So there is this sense of accountability, right? But I think besides the personal training that Dr. Knowles talked to you about, which I agree, I mean, having the expertise of someone that know what they're doing to help them, it's very critical, right? But also another strategy is family members. Family members that will push them. No, I'll go with you. You know what I mean? For example, my mother, she does her exercise and stuff, but, if she end up having cancer, I don't think she would go. But if I said, no, you're coming with me, and you're coming because you're going to feel better, give me a chance, and let me take you. And I go there, I participate a little bit, just to get her introduced and stay for a little while. After she start experience that and start feeling better, there's a greater chance that she'll adhere to the process.
I'd like to get very specific for a minute, and that's to talk about kinds of exercise, because you've now had a lot of experience with different kinds of cancer. So colorectal cancer, breast cancer. Are there some exercises that are just universal? Or are there some kinds of exercises that are better for women with breast cancer or men with prostate cancer or people with colorectal cancer? Help me understand how you would help devise, if you were somebody's personal trainer, for example, the right exercise for them.
Right. No, this is an outstanding question, too, very important. We do have guidelines, general guidelines, right, that we will set, and patients can try to follow those guidelines in a very general sense. But every different type of cancer, the types of treatments, the types of surgical procedures, all of those factors must be taken into consideration when you are designing an exercise prescription for a cancer patient. Yeah, there are some general things that we can tell people to do, which is safe and most likely will impact their health positively. But there are some specific cases that you need to really, take into consideration all those factors.
For
Give us some
example,
examples, please.
Let's suppose you have a woman with breast cancer that had a double mastectomy and severely have changed the way the shoulders function. They're experiencing soreness, pain, even months after surgery, right? So, I can't do certain types of exercise with that patient because it's not going to be comfortable. So I have to rebuild the body in different ways until I fix, certain areas of the body that allow them to then start engaging other muscles to be able to execute different types of exercise. So patients that had problems and even had some cardiovascular complications, right? I mean, I can't train them the same way I would train somebody with no cardiovascular complications. So I'm going to start very slow. The dosage has to be adapted. That's why the personal trainer, the individualized prescriptive approach is extremely important.
So we've talked about different types of cancer, different what people bring into this exercise program. Have they had surgery? What capabilities do they have? But what about age? And what about men or women? Do you need to adapt the exercise program based on those factors?
Yes, I think not only those factors definitely play a very important role on how we're going to prescribe the exercise correctly for those individuals. But very important is the clinical state of the person when they come to you. That's very types of treatment they underwent, types of symptoms and side effects that they're still experiencing. All of those factors, we take that into consideration before you design an exercise prescription. But going back into age first, the older the patient, we gotta be more careful with certain types of exercise. For example, I'm gonna avoid quite a bit balanced types of exercise to not risk them to fall. I'm going to be more stable, more safe on my prescription in that particular. Although, do they still need to work on some balance? Probably.
Yes,
Probably.
they do.
Correct.
I can tell you that with some assurance.
No, absolutely. But the way we do that will be a little bit different, right? In a much more safe way, and so forth. The amount of exertion too. At that point in time, if you want them to keep coming back to your facility and exercise regularly. And I got to be honest with you. We all try to create a dose response of exercise and train them, to get the benefits of exercise more expressive. But a lot of times it's about the consistency of training over time. So, and lastly, between men and women, I think both, it's fairly similar, the approach, okay? I believe, though, that the women needs more social support. I think it would be important to have other women together to create that support system that's incredibly important. I've seen that for breast cancer. Men's not so much, but it's still very similar approaches.
You're listening to Dr. Claudio Battaglini. He's professor of exercise physiology and director of the Graduate Exercise Physiology program at the University of North Carolina at Chapel Hill. Dr. Battaglini is co-director of the Exercise Oncology Laboratory in the Department of Exercise and Sport Science. He's also a member of the UNC Lineberger Comprehensive Cancer Center.
It's time for a short break. If exercise is a value throughout our lives, shouldn't we start when we're young? What will be the effects of giving up physical education classes in school?
Emotional support for exercise is important, but so is financial support.
Insurance companies pay for cardiac rehab. Why not cancer rehab?
We'll get some practical advice on finding an exercise program.
What online resources are available for all of us?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
Welcome back to The People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Sonu, an FDA-approved drug-free treatment for nasal congestion and runny nose, using sound instead of steroids. More at getsonu.com. That's getsonu.com.
Our grandparents and great-grandparents were likely far more active than our children. Young children, they played outside. Schools had mandatory phys ed programs, and adults spent a lot more active time at work or doing leisure activities. Today, we're all mesmerized by our screens. What are the impacts on our health?
Our guest today is Dr. Claudio Bartolini. He's professor of exercise physiology and director of the Graduate Exercise Physiology program at the University of North Carolina at Chapel Hill. Dr. Bartolini is co-director of the Exercise Oncology Laboratory in the Department of Exercise and Sports Science at UNC. He's also a member of the UNC Lineberger Comprehensive Cancer Center.
Dr. Bartolini, when I was in school, a long time ago.
Oh, my goodness.
We had phys ed almost every day.
I have to admit, I didn't like it.
Well,
I was not very good at it, and I didn't like it. And I had one gym teacher who made fun of me because I was not very good at it. And that made me like it even less.
But every day, when I was really, elementary school, recess.
Oh,
Yeah, and you get to run around and you get to play.
Everybody liked that.
Everybody liked recess. And phys ed, it all depended on the coach because some coaches are, jocks and they're difficult for people like Terry. But that aside, a lot of schools have given up on physical education.
They're cutting their budgets.
That's got to be painful for you.
yes. This is a big problem that has been happening, continue to happen throughout the years. I have a great colleague. He just retired, but he's still around. They did significant amount of work here in North Carolina around pretty much every single county, studying the impacts of phys ed on the health of the children. And he actually, at that time, 10, 15 years ago, he was able to go to the legislation and say, look, if you want to keep our kids healthy, they need to do this, and this is the amount that they need to do. It's absolutely spectacular. And they were able to implement some of those programs in school and so forth, right? But since then, as you guys know and you mentioned, there's less and less physical activity, less time for phys ed in schools, which to me, of course, being an exercise physiologist and studying that and also work with children, it's a disservice to our children. To not have them achieve the activity necessary for health development and to maintenance of great health. So that's why now you see kids developing type 2 diabetes, which is a disease of older people, with children ages 10 to 15 years old, something that we have never seen before. So yes, this is a very serious issue that we need to fight for it. We need to change. We need to get phys ed back to schools.
Well, speaking of fighting for something, I have to tell you, I am on the warpath when it comes to cancer rehabilitation. And the reason I say that is because the cardiologists figured out a long time ago that cardiac rehab was essential for people who were recovering from a heart attack, for example. And they fought successfully to incorporate exercise. People have a heart attack and the next day, or even the same day, they're up walking the halls with a nurse or somebody, holding them, making sure everything's fine. And then an exercise program evolves from that. And so cardiac rehab is just built into the system.
Correct.
And the insurance companies pay without even questioning the value of exercise after a cardiovascular problem. We need the oncology community to fight just as hard for cancer rehab. And we need, like you have already described, centers where people can come and feel supported and have exercise physiologists tailoring the exercise program for them. And so every cancer center in this country should have a cancer rehab program. And then we need the insurance companies to go, right on, we're going to support this. We're going to pay for this because we're paying hundreds of thousands of dollars for drug treatments.
Yes.
And exercise may be just as effective. So,
And a whole lot less expensive.
Oh my
so
goodness. Yeah,
I'll get
I
off
agree
my high
100%.
horse. Your thoughts, Dr.
Oh no,
Badalini.
I agree with you 100%. And even in cardiac rehab, right? You know that they changed that throughout the years for less sessions to save money. You know, they were able
I
to.
did not realize that. No.
Yes, cardiac rehab at one point in time was X amount of weeks. Now the insurance only covers X amount of weeks, which is less than before. And I know that because I had a director of cardiac rehab from UNC come to my classes and my clinical physiology classes and tell my students the latest and greatest in cardiac rehab, which, it's interesting. Oh, no, the insurance company figured out that amount of exercise for that amount of time was enough to rehabilitate the heart, Anyhow, in the cancer world, we're not even there, like you said. We don't even have that ability to build, the insurance companies or Medicaid, whatever it is, to allow these patients to be able to rehabilitate from the treatment process. That's a big, big problem. And some researchers around the U.S., I know a group in Boston, that a physician took the lead on that and said, I need my patients to exercise. And they end up figuring out how to provide some exercise through physical therapy.
Because physical therapy
Can
would be
billed.
covered.
Correct. And they would set up the patients to go into physical therapy, right, and be refunded or paid by, and also they would include some exercise physiologists to be more holistic and train them the way that we would love to see these patients training. But it is. So there is a big push, there's a lot of great champions in the United States here, Dr. Katie Schmidt, that used to be the president of American College of Sports Medicine. She leads a great effort, to try to get cancer rehabilitation funded, or being able to be billed through insurance and so forth, right? We'll continue to do that. And to be honest, I still don't understand why this has not been completed.
Because we need to have all of the people with those deep pockets who may be listening to our show to start thinking about cancer rehabilitation programs. You can fund them at every cancer center in the country, but we also need Medicare and Medicaid and insurance companies to get on board. But in the meantime, until that happens, what can people do who have been diagnosed with cancer or have recovered from cancer? What can they do online? How can they come up with a program that will work for them? Because the physiological benefits are not just you get stronger and feel better, but you can reduce the risk of recurrence. You can improve survival. There's so many physiological benefits that have now been demonstrated.
Correct.
So help us understand what can people do until the medical community and the insurance community and every other community gets on board the program. Help people.
That is a great question. I think one of the ideas, okay, and I know the physicians already have their hands full. They're so busy that it's very hard for them to even think about, okay, but starting from the physicians saying, figure out some resources that they can provide to the patients, such as, okay, if you're at UNC, it's easy. All the physicians are doing a wonderful job referring them to the Get Real and Heal program. We have that built in our system, so that's amazing, right? But other hospitals don't do that. They don't have that. Some are beginning to develop those programs, and that's a wonderful thing. But I think starting from the physicians, nudge, say, look, I know this group, I have some information about this group. I really wanted to get in contact with them, and I wanted to start, an exercise program. Okay, that's one of the ways to try to do that. Other ways, it's more advertisement from nurses and physicians. Be more knowledgeable on where those programs are available. There are not many. You're absolutely right. It's not already available that you can go anywhere. But here, the YMCA, for example, in Chapel Hill, used to have a cancer rehabilitation program through the Live Strong Foundation. They started. I was part of it. I trained many trainers in the YMCA's, along with some great colleagues in the United States, to implement that program for people at a very reduced cost. You know what I mean? So, but I think it starts from the physicians doing the research or have information about different types of programs. Not every place we're going to have that, unfortunately. And then through universities too, some programs that teach exercise oncology today, which is growing. There's more places doing that, and get the patients in contact with those directors, those scientists, and get that information.
What about online? Are there any resources where a cancer patient could go online to get some encouragement and some exercise programs? Because we now see, I see young guys and women for that matter, getting on their bikes and watching a program on the TV and they're, following it. Shouldn't there be something sort of comparable for cancer patients?
Joe, I think you're being very progressive and very smart about it, because it's not of my knowledge that we have that, but we should have that. I think you just giving an idea to the audience here, and even guys like me should think outside the box and say, you know what? Those resources, I'm pretty sure there are, but they're not very well advertised. But that is a tremendous idea.
Now, if you wanted to find a personal trainer who'd be able to work with you, how would you go about doing that?
Yeah, that's another good question. My recommendation, in an ideal world, okay, if you are going to connect with a gym or a program or a personal trainer, take a look at some of the qualifications first and foremost. I think this is critical, right? Having a college degree in exercise science, certification that is specialized in cancer. For example, the American College of Sports Medicine has a cancer specialist certification. I'm sure that's not the name, but you got the point. Some individuals that have experience of exercising with people with cancer, that will be the first requirement. And try to get in touch with those individuals. Or personal trainers in general, just ask, right, look, do you have any experience work with cancer patients? Mm-hmm. What is your background, to be able to do this? And go from there, starting from there. But again, a lot of the cancer centers, right, such as here, we're very, very blessed because we have the Lineberg, we have the Duke centers, we have fantastic cancer programs that patients can potentially call and get some information. People will, direct you to certain programs, but we don't have many, unfortunately.
Now, I'm thinking about something that a lot of people do have access to. I'm wearing a watch that counts my steps. Mm-hmm. So if I want to increase my physical activity, I can measure it myself. And in fact, my watch tells me you get a reward every month if you meet the criteria, and it's different every month. Uh-huh. So I need to pay attention, and I need to make sure that I'm getting the amount of activity that the watch is watching for. Can that be helpful in any way?
Yes, and as a matter of fact, there's a huge line of new research looking at wearable devices that can also be created into a network of people, and what your friends are doing, if you're doing, to try to motivate people to become more physically active. I think that's a valid way to motivate people to do it. But I always recommend, before you do anything, check with your physician.
Oh, absolutely.
Make sure that you're clear to do that.
Steps. We keep hearing, 10,000 steps. No, you don't need 10,000. You just need 7,000 steps.
Well, it depends on how old you are.
Right.
For one thing.
And also how fast you're walking. So just tell us, as an exercise physiologist, as someone who's worked with a lot of different kinds of people, what about just plain walking?
I think walking is one of the best exercises for anyone. Okay, of course not for athletes, because athletes need to be pushed to a certain level that they are looking for improving performance,
in their specific sport.
Correct. But walking, it's something that we should
humans do.
We should, exactly. And Pointzer, there's a scientist at Duke, anthropologist, and very intelligent, a great colleague that has a very important piece talking about being active and walk, right? And he went to study chimpanzees and gorillas and look at the amount of walking that they did and compared to humans and things like that. There's a wonderful piece that I recommend people to read about it. But to your point, I think it's still that for older patients primarily, or even mid-age patients, walking in a regular basis, instead of being concerned too much about the level of intensity of physical activity, maintaining regularity. doing that almost every day of the week for at least the 30 minutes recommended, in my opinion, that goes long ways. It's very important. Now, the 10,000 steps, okay, this is a generalization of a very large sample where, yes, if you walk those 10,000 steps a day, that maintain good body health, weight, and so forth, right? But that doesn't work for everyone. So if you're an athlete, like me, for example, I walk 20,000 steps a day, and still I probably need a little bit more intensity on my workouts, such as jogging, running. I ran this morning already 30 minutes because I really need that to feel good, to feel sharp. And but I think the 10,000 steps is very important to people to continue to try to achieve that. Doing less than that may be important. Okay, I don't think the science is very strong to tell us that, but I think that doing something, in my opinion, is better than doing nothing.
Dr. Ballardini, a lot of people talk about how good walking is for health. But there are some folks who just sort of mosey along, strolling. And then there are other people who are going so fast you can barely keep up with them. And then, there's
And if you're trying to walk together, that makes a problem.
And if you've got a dog, you're trying to, coax along behind you. So talk a little bit about how speedy you need to be to get benefit from walking.
Right. In order for you to maintain good health, in walking, of course, is an aerobic exercise. You're going to impact significantly the cardiovascular system. You need to have a certain level of the exertion that you are raising your heart rate at least to a certain extent. So you can harvest the benefit of sheer stress on the vascular system, so to keep your vascular function healthy, your heart healthy, and the delivery of oxygen to the muscles in a very healthy way. So, I always tell my patients, if you can walk in a pace, okay, that you can still talk, but it's not as easy to talk, I think you're harvesting great benefits, because your heart rate is going to be coming a little bit higher for an extended period of time. You go 30 minutes, 40 minutes, even hour walks. That particular level, as a general guideline, not work for everybody, but raising your heart rate to a level where you feel like, okay, I'm walking here, I can talk to you, but I'm huffing and puffing a little bit. I think that will potentially be a good starting point for those that are not exercising on a regular basis.
Dr. Ballardini, there are people who have joint problems. Their knees are creaky and their hips hurt a little bit. And so for them, walking and obviously running is kind of out of the question. Mm-hmm. What about your favorite sport, swimming?
Without a doubt. Of course, I'm biased about swimming, right? And not everybody likes to swim. Until you learn how to swim and you enjoy the practice of swimming, it takes a little bit of time. And when you refine your technique swimming, it takes a little bit of time. But when you learn that, it's a lifelong sport. Anyone can be in the water with much less stress on your joint, much less, pounding, so you don't come out of the pool sore the next day. So you can swim every day if you pretty much want to. But it's not only swimming, right? There's a lot of those aqua activities that people do these days, the aqua aerobics, which can reduce significant impact of the joints because, of course, you are in water. A lot of times they use water jogging belts, to really minimize the stress on the knees, hips, and ankles. I think all those aquatic activities where you are minimizing the stress or the pounding of the joint because the water is really taking that away, I think it's an incredible type of exercise. I think people that suffer from knee problems, hip problems, any joint problems in general, the aqua activities, I would highly recommend them, right? Other activities that are non-weight bearing as well, such as cycling and also using the elliptical machines, they could be other good resources for that. I personally love the elliptical machine because I'm a runner, run almost every day. But when I'm really sore, I can hop on the elliptical machine and suddenly I'm not in pain. I can do it for longer, for a good level of exertion, and, I am being consistent with my workout. So, and one last thing that is very important, not only the water, the cycling, the running, I think cross-training, the concept of cross-training, as you age, it becomes more and more important. For example, I can go 2 days in a run right now, which I love it, but I will be sore. I'm not going to lie to you. My knee going to be screaming, right? Even more if I'm a few pounds over my normal weight, I will be feeling that. But then suddenly I hop on a bike ergometer, just to continue my daily activity. And then the next day, my knee is much less sore. So that allows me, when I cross-train, to be consistent with my training. You know what I mean? And I think as you age, it's very important that people do that. Go into the water, go into the bike, cross-train, but keep doing it.
And resistance training.
Without a doubt. Resistance training, at least the recommendations 2 times a week. I would even go further, 3 times a week of weight training. It's highly recommended to keep the healthy muscles, but not only that, stress on the bone. Because as we age, we'll become osteopenic first, right? You start feeling that the loss of bone mineral density or bone mineral content, so you become osteopenic. And that can lead to osteoporosis in the future. So to avoid that, some impact activities are important.
What kinds of activities, since you mentioned osteoporosis, what kinds of activities are recommended for perhaps slowing the advance of osteoporosis or possibly even reversing? Do we have any research on that?
Yeah, reversing, not so much. As we age, is very, very difficult to start packing bones, right, and remodeling your bones. It becomes different. And it's a combination of not only the stress on the bone, but also diet. You got to have a calcium present. It's not only one or the other. You got to do both in combination to be able to have healthy bones. So the amount and the impact of the exercise, it depends on the age of the person, depends on any comorbidity that the person may have or any orthopedic issues that the person have. But, progressively, I always like to be cautious. I'm more cautious than most of exercise physiologists when I'm dealing with clinical populations. Yeah, we want to create a dose response of the exercise, but I would rather see, instead of a dose response, a consistency of training over a long period of time. Because I see those that maintain that regularity for a long time, those are the ones that are really healthy and looking very good. So to answer your question, those adaptations that needs to be made are very individualized. And, the amount of stress that I'm going to impose on the joints or on the bone, the skeleton, with exercise, it's going to depend on different factors. And also, as we age, what is the risk we're willing to take to go to a heavier bout of exercise that might end up in causing an injury, and then I'm out of that exercise for the next amount of time. So we need to be very careful and balance very well, the benefits versus the ratio, right, between training hard for attaining certain benefits or a little lower, but maintaining those benefits for a longer period of time.
And finally, Dr. Bartolini, the importance of friends and family in supporting our exercise regimens, our activities. Let's just get your sense of why that's so critical to this whole process.
Yeah, well, when you go out and exercise with someone, with a friend or a family member, it's more fun. It's fun. We talk about different things that perhaps we don't even have time to talk during our daily lives. When you talk about athletes, a little bit different. Athletes are so focused on a particular goal, they're going to go out and train hard, either they have companion or not. Although training in a group, even if you are a professional athlete, it's much more enjoyable and there's a lot of benefits of that. But for us, normal folks that are just wanting to improve our health through exercise, the group exercise, having a partner, have a good friend that is going there walking you do or going to the gym we do on a regular basis. Well, that is a total different experience. I think that allows you to create a certain level of accountability that will keep you, from missing sessions, keeping you from getting unmotivated, and you keep going. I think that is a very, very important part of the process. I'll give a quick example because I know we're out of time here. But in swimming, for example, right? When I coached my son at the beginning, I was coaching him very lonely, himself and I in the pool, and it was great. But I could tell that he was bothered seeing other kids having teams and work and having fun in this. So then I started bringing swimmers to swim with him and create our little group. Oh, I could see the difference in the mood and the difference in the effort, the wanting to come to practice, to see the friends and talk and goof around and the kind of social experience, right? So it's very similar in my opinion. I think for mental, for the community, it's awesome. It's great to have a good group of folks and you meet and you exercise, and it's always very pleasurable and very motivational.
Dr. Claudio Bartolini, thank you so much for talking with us on the People's Pharmacy today.
Oh, my pleasure. I really enjoy being here with you all, always.
You've been listening to Dr. Claudio Bartolini. He's professor of exercise physiology and director of the Graduate Exercise Physiology program at the University of North Carolina at Chapel Hill. Dr. Bartolini is co-director of the Exercise Oncology Laboratory in the Department of Exercise and Sports Science, and he is also a member of the UNC Lineberger Comprehensive Cancer Center.
Lynn Siegel produced today's show. Al Wodarski engineered. Dave Graydon edits our interviews. B.J. Liederman composed our theme music.
This show is a co-production of North Carolina Public Radio, WUNC, with the People's Pharmacy.
Today's show is number 1442. You can find it online at peoplespharmacy.com. That's where you can share your comments about today's interview. You can also reach us through email, radio@peoplespharmacy.com.
Our interviews are available through your favorite podcast provider. You'll find the podcast on our website on Monday morning. This week, you'll find information about walking speed. Does that matter? We'll also discuss swimming as a way to protect your joints if walking is difficult. Does cross-training become more important as you grow older? What kinds of activities can slow osteoporosis? Be sure to tune in if you're interested in the importance of family and friends supporting our exercise goals.
At peoplespharmacy.com, you can sign up for our free online newsletter to get the latest news about important health stories. When you subscribe, you also have regular access to information about our weekly podcast, so you can find out ahead of time what topics we'll be covering. Speaking of that podcast, we'd be so grateful if you would consider writing a review of the People's Pharmacy and posting it to the podcast platform you prefer. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening. Please join us again next week.